Hello again, everybody. I'm Scott Murray. Welcome to today's edition of 5 Talk Street. Hey, did you know that every 40 seconds someone in the United States has a stroke? Or that stroke is the #3 cause of death in the United States? Dr. Russell Fisher is a representative of the American Heart Association and a cardiologist with North Texas Cardiology and Electrophysiology. I recently sat down with a good doctor to find out more about the warning signs of this and other heart-related diseases and what we can do to avoid them. First of all, let's just start right at the top. A cardiologist, what do you do day to day?
We take care of patients with all various types of cardiovascular disease. People that have had heart attacks, people that have heart rhythm abnormalities, those at risk for developing those conditions. We see patients that complain of chest discomfort, patients with shortness of breath, and help differentiate what the etiology of their symptoms are.
Shortness of breath all of a sudden overcomes me, takes me, or as you said, I've got some pain here or something. What's the first thing I should do?
First thing you want to do is to assess the severity of it. If you have a sudden onset of these kind of symptoms, you suddenly get short of breath, suddenly notice chest discomfort, you really want to seek medical attention as soon as possible. Generally dialing 911, getting in touch with a medical professional is really what you want to do as fast as you can because time is of the essence. If you're dealing with a heart attack or a stroke, the sooner that you're evaluated by medical personnel, the sooner that we can help prevent long-term complications.
And when you talk about a stroke, isn't there like a 3-hour window in there?
There is. When at the onset of symptoms, if you're seen by at a facility that has the ability to give a medication such as we call thrombolytic therapy, clot busters, then you can help prevent the long-term ramifications of that stroke. So, but time is of the essence. If it's more than 3 hours, the damage has been done, and it's usually irreversible.
You talk about clot busters. Somebody once told me if you feel really, excuse me, tough chest pain, try some aspirin. Is that?
That's a good idea. And usually what you want to do is you want to get the aspirin in as soon as possible. And generally you want to take either 2 baby aspirin, 160 milligrams, or full aspirin, and chewing it will get into the system faster. That's a platelet inhibitor. They prevent the platelets from clotting into the plaque that usually causes the problem.
Right. Well, let's talk about a number of things today, but first of all, the one that comes to mind, I saw a statistic the other day that 2/3 of Texans, we're talking men, women, boys, girls, are obese or overweight.
Unfortunately, that's very true.
2/3, that's almost 70%.
Amazing. And you know, it's related to obviously our diet and our exercise program, or lack thereof. But really, watching what you do, watching how you run your life makes a huge difference. The problem with this is that the patients that have obesity put them at increased risk for multiple medical issues, heart disease, high blood pressure, diabetes. Usually they're associated or frequently associated with high cholesterol. So all these factors are cumulative. The more of these factors you get, the greater your risk of a cardiovascular event.
Obesity certainly seems to be a problem that has come about in the last, I don't know, 5, 10, 15, 20 years. I remember as a kid growing up, if you saw someone that was overweight, it was really kind of the exception, not the rule.
Yes.
And it's kind of reversed now. And yet I wonder, as I think back, is it because of the obesity and the increase of it, or is it just because of the great medical science and the strides that medical science has made that we are more aware of all the problems that can come about if you don't take care of yourselves, and all the things that the American Heart Association continues to do to say, hey, get smart, folks. You want to live long? Then be smart.
Absolutely. And not only that, there have been very large epidemiologic studies that have been performed over the past 30, 40 years. One that comes to mind is a Framingham study that looked at large populations of people and said, okay, if you are obese, what happens to you 20 years down the road? If you smoke, what happens to you 20 years down the road? And having the long-term trials, the observational trials, where we can go back and say, they were fine 20 years ago, but now they have started smoking, now they have high blood pressure, now they're obese. What happens? And we have seen this huge rise in cardiovascular diseases, and it's certainly related to those risk factors.
Well, you talked about stroke here at the top. Can you talk a little more about what a stroke is, how we might know if I was sitting here? How would I know that I'm having a stroke?
Sometimes you may not, but others around you will.
All right.
Many manifestations of stroke can occur. Number one, there can be a loss of speech, meaning you know what you want to say, you can't get the words out. Suddenly you have loss of function on one side of your body. Sometimes you have a little facial droop, one side of the body, one side of your mouth droops down. Sometimes an eyelid drops down. Some patients that are at risk for future stroke complain of what we call amaurosis fugax. And amaurosis fugax is where there's like a veil that comes down over your eyes. If you ever experience that, and it tends to be transient, it comes and goes, but if you get that veil that comes down over your eyes, that's frequently a sign of carotid artery disease, which can lead to a stroke.
Now, is that you just simply can't see? It's
just
like
a veil comes down over the eyes. You get this, and then it goes away. And it may last anywhere from a few minutes up to hours at a time. But that's really a red flag. That's a high-risk patient for stroke in the near future.
And again, another statistic, I'll drive you nuts with some of the things that I've read lately, but 50,000 people die every year here in the state of Texas.
Yes,
is that right, from cardiovascular disease?
Yes.
Unbelievable.
Huge numbers. In a year, 56,000 Texans will have a stroke. I mean,
wow.
It's huge numbers. And the recognition of the symptoms, the recognition of the risk factors, and any modifying things you can do to adjust those risk factors hopefully will help reduce that number. But you have to understand what the risk factors are and say, am I at risk? And if I'm at risk, is there something I can do to prevent it?
Well, we talked about smoking for years, and I think people, hopefully most of the population is getting smart. You go to restaurants, there's no smoking, you go to other, and yet you still see so many prevalent problems out there, and you say, my gosh, why don't we get it?
Well, smoking is an independent risk factor for stroke. There are over 21,000 strokes a year attributed to only tobacco use.
Really?
If you're a smoker, you're at double risk of having a stroke than a non-smoker. And it's not just, there are two kinds of strokes that we see. There's the embolic or the ischemic stroke, and then there's a hemorrhagic stroke. Well, the smokers are even 2 to 4 times increased risk of having a bleed. So it's not just the ischemic stroke, it's also the bleed.
So let me give you this forum, this opportunity. You're a cardiologist, you're well-trained, you're well-educated. You've seen patients for umpteen years. So what would you say to the public if you were given 30 or 40 seconds? Hey, folks, let's get with the program. Let's realize what we need to do to keep ourselves safe and healthy.
Well, what you really want to do is if you have a risk factor for stroke, you want it addressed. Patients that have hypertension are frequently underdiagnosed and undertreated. And high blood pressure is the #1 risk factor for stroke. So if you have high blood pressure, not only is it important to make sure that you know you have high blood pressure, but take your medicine and make sure that you take your medicine regularly. It's a sad statistic that 71% of people that have high blood pressure have been diagnosed, but only 60% of them have been treated, but only 35% of them have control. So even though a lot of people know you have high blood pressure, they're not even controlled with the treatment. And the treatment, really, you want to get aggressive, and sometimes it's a couple of drugs. We have good drugs out there now, and every single drug has been found to reduce the incidence of stroke if taken.
Dr. Fisher, I could talk to you forever. You're a plethora of knowledge, as they say, but thank you so much for stopping by, and thanks for all you do.
Thank you so much.
Thank you very much. We're back with more of 5 Talk Street right after this brief timeout.